telling folks in the room here about the masks still matter graphic that we have up on the screen, and just highlighting the fact that COVID is not over, and we need to continue masking in public spaces in order to protect the most vulnerable among us. So moving on, we're going to talk a little bit today about the pandemic. I'm sure everybody is surprised to hear that. It's been a really challenging few years for workers in Manitoba, from exhausted healthcare workers to COVID-19 outbreaks among workers in meat processing plants. Workers have borne the effects of the pandemic while needing to continue to show up to engage in the important and essential work that our society depends on, which the pandemic has only highlighted further. Not all workers have experienced the pandemic the same way, and we know that racialized workers and communities have been disproportionately impacted by the pandemic. So as you can see here, 61% of those who tested positive for COVID in Manitoba were Black, Indigenous, or person of color. This was from the case data and racial, ethnic, and Indigenous identity working group that was pretty unique to Manitoba. That was headed by Dr. Marcia Anderson. And so only 35% of people in Manitoba actually belong to a Black group. So it was pretty disproportionate. The first workplace outbreak in Manitoba, not surprisingly to us, was in a meat processing plant where many newcomer and migrant workers were employed. Workers organized and made calls, desperate calls, to close the plant, but these calls were ignored. Their work and the profits of their employer deemed too important, and their health not important enough. Migrant farm workers did not fare any better. The Auditor General released a scathing report at the end of 2021 that found that federal inspectors did not properly enforce pandemic regulations to protect farm workers from COVID-19. The report found inspectors approved employers' pandemic plans with little or no evidence collected. OHC also spent 2 years of the pandemic working with nail salon workers, mostly racialized women workers from the Vietnamese community. These workers lost much of their income when their salons closed for almost half of the entire first year of the pandemic. Like other women workers, many of these were mothers, parenting children of all ages through the pandemic, trying to support the educational needs, social needs, and mental health needs of their children. With everyone at home more, the increase in domestic work was also disproportionately borne by women workers. Single mothers experienced this even more keenly. Many left their jobs and had difficulty returning to the paid workforce. That care work was primarily borne by women at home, but was also borne by workers in personal care homes, caring for the elderly. Both workers and residents were subjected to far too many COVID-19 outbreaks and deaths, calling into question the very way we care for the elderly in this country. At the bottom here, I have a stat just indicating that 16,000 care residents died because of the pandemic. It's actually closer to 17,000 now. This was a stat from February. As a workers' health center, we view occupational health as having a key role to play in protecting workers during a pandemic. The World Health Organization describes occupational health this way: should aim to promote and maintain the highest degree of physical, mental, and social well-being of workers in all occupations, the prevention amongst workers of departures from health caused by their working conditions, the protection of workers in their employment from risks resulting in factors adverse to health, the placing and maintenance of the worker in an occupational environment adapted to their physiological and psychological capabilities. So the highest degree means we must do more than the minimum. We must create workplaces that enhance and promote health, not just reduce or manage some acceptable level of illness. It means that we need to do our utmost to provide workers with the most effective protections they need to stay safe. This is a slide of the hierarchy of controls. Folks who are familiar with occupational health may have seen this before. One of the things that we do at the Occupational Health Center is use this hierarchy of controls to determine how to best protect workers. So dealing with hazards at the source is a key feature of this approach. So elimination, We understand that approaches that focus on worker behavior are less effective at preventing injuries and illness. And we need strategies that pay attention to the working environment rather than the individual. So we go from eliminating the hazard at the top all the way to PPE at the bottom. It's something, it's better than nothing, but it is not better than eliminating the hazard. We know that limiting exposure to biological hazards has always been an occupational health challenge, especially for a virus as contagious as this one. For this reason, most occupational health experts support a multi-layered approach to prevent the spread of COVID-19, commonly referred to as the Swiss cheese model. So multiple layers are used in combination, including remote work where possible, improving ventilation, vaccines, frequent testing, and effective masks and respirators, hence our masking campaign. Workers' health and safety rights are also fundamental to occupational health. These rights were fought for and won by working people represented by the labor movement across Canada in the 1970s. OHC's work with newcomer workers largely focuses on training on the topic of health and safety rights. The pandemic showed us where these rights proved inadequate in a time of crisis. Missing one, apologies. Over the past couple of years, we've received many inquiries from frontline workers who were afraid they were being unnecessarily exposed to COVID-19. Yet we began to learn that exercising the right to refuse was exceedingly difficult. While employers needed to show they were taking some prevention measures, they were not held to any clear standards of what would represent an effective approach from an occupational health perspective, especially one that considers the source of the hazard and environmental controls, or the need for multiple layers of protection. Workers were then left without much help to back up their concerns of dangerous work to exercise and work refusal. Health and safety activists who advocated and campaigned for workers' rights to be enshrined in the 1976 legislation in Manitoba recognized that the right to participate and the right to refuse unsafe work would be of limited use without the right to know. Here's where the approach to the pandemic in Manitoba fell short in a very fundamental way for workers. The reluctance of international and governmental bodies of all levels to recognize the airborne nature of COVID-19 in a timely way really hampered our ability to prevent its spread. Public health guidelines sidelined workplaces and offered insufficient guidance to employers on how to address indoor air quality. Workers have a right to know about the hazards they face and how they can safely work to deal with these hazards. It's critical to understand how an airborne virus spreads in order to understand how to work safely. In a recent focus group OHC did with newcomer workers, it was clear that the mixed messages and conflicting advice from their employers and from government has been confusing. They were not aware of the importance of ventilation to reduce transmission or the enhanced protection provided by an N95 respirator compared to other masks. When they followed their employer and government guidelines and still got COVID, it led to decreased trust in the information they were receiving, as well as increased fear in the absence of understanding what mitigation measures are most effective. Public health messaging placed a heavy emphasis on individuals' personal responsibility to avoid infection, while downplaying the social, economic, and workplace conditions that contributed to acquiring COVID-19. This approach has put blame on individual workers and communities, compounding racism and racist incidents for those workers and communities already disproportionately affected by higher case rates. So just to circle back, the data on work refusals reported to labor authorities shows that there's actually a spike in the number of people who have formerly refused work citing dangerous conditions, but actually none of those work refusals were upheld. This is a quote from our newcomer focus group participant. We held a newcomer focus group in March 2020 to kind of discuss the impact of the last 2 years on these workers who, again, were mostly working in frontline essential work roles, and their experience of the pandemic is quite significant. So just to highlight, it says, I just feel worried everywhere because I know the virus can spread in the air or by the item they touched, and maybe I will touch. You never know. No, I don't feel confident at all. I just pray every day. We also believe that there hasn't been nearly enough attention paid to the mental health needs of workers, given the high stress environments many experience. Workers everywhere are having a difficult time coping with chronic pandemic-related stressors and have received limited support from their employers or in the community where mental health services are overextended and chronically underfunded. Bringing an occupational health lens to mental health during the pandemic, we know it's crucial to address the root causes that result in chronic stress at work and potential harm to our mental health. Root causes such as a lack of protection from COVID-19 at work, minimum wage earners not making enough to make ends meet, racism at work and in the systems that are supposed to protect us, and intensification of work demands, particularly over the pandemic, the lack of control at work. The Institute for Work and Health released a study, now this is back in fall of 2020, I think it's only become exacerbated since then, but workers who felt safe at their physical work sites had better mental health than workers who felt workplace COVID-19 safety practices were inadequate. So folks who had to be at work but felt that they provided adequate PPE and protection had better mental health than folks who felt that workplace, the same thing, they had to be at work, but they felt that the protections were inadequate. We know that what happens at work often doesn't stay at work. For example, when a worker is off sick and recovering at home, it impacts not only their colleagues, but more importantly, their families and their communities. Workers in workplaces do not exist in isolation. The division between community and workplace exposures during the pandemic was somewhat artificial, and workers in a number of settings felt that the determination that they acquired COVID in the community rather than at work did not match their experience in terms of where they were most likely exposed. Workers are embedded in the fabric of society, and protecting workers' health at work must be a high priority during a pandemic or any other health crisis. Many workers and their families have lost loved ones during the pandemic. In Manitoba, we have now lost over 2,000 people due to COVID-19. As we begin to imagine a future where we finally emerge from this pandemic, we know better than ever that the future must center the health, well-being, and recovery of the workers who have labored so hard, borne so much illness, uncertainty, fear, and loss. Many of the problems that were exposed during the pandemic were structural, and this is where many of our solutions will be found. OHC has advanced and will continue to promote different recommendations throughout the pandemic, which include strengthening public health education in the province, developing clear messages about the transmission of COVID-19 as an airborne virus, and widely communicate appropriate guidelines for reducing transmission based on airborne spread. This public health education should be done in clear, simple language, be widely shared through various mediums. Information should be available in multiple languages. Adopt and enforce standards on ventilation for workplaces that will ensure clean and healthy air in all workplaces and public spaces. While this may seem daunting, it's not impossible. As Dr. Lindsay Marr points out in the New York Times at the beginning of the 20th century, improvements to water and sewage systems dramatically reduced common waterborne diseases such as typhoid and cholera. Advances in water waste management are now considered one of the greatest public health achievements of the previous century. Investing in improvements to air quality to reduce disease should be our public health focus for the century. This is a quote from the article. It's a great article shared on social media for folks who are curious about finding out more. We also need to strengthen the health and safety rights of workers to ensure that they can actually be exercised when they are most needed. This requires a strong and vibrant labor movement that can help counteract the power held by employers and over workers' health and safety. If you're part of a union, I'm quite sure most of you are, consider becoming more active. If you're not part of a union, consider organizing one. We also need to work against systemic racism and structural inequities that result in marginalizing workers and communities who bore the brunt of this pandemic. This requires preferentially directing resources to those communities experiencing oppression and listening to and supporting organizations who represent them and advocating for their interests. We need to implement universal paid sick days immediately for all workers in this province to ensure that low-waged workers' income is protected when they must be off work due to illness. A voluntary program for employers does not meet the needs of workers who need this protection most. We need to raise the minimum wage to reflect a living wage and meet basic needs. We know that poverty crushes lives and causes illness. The workers who put their health on the line to keep our society functioning during this global health crisis deserve to live with dignity, health, and a decent standard of living. Everybody deserves this. Strong public investment in the care economy. This needs to prioritize higher wages, better working conditions, and health and safety for the mainly women and racialized workers in childcare, long-term care, and gender-based violence service provision. This will benefit women working in these jobs, the people needing care, as well as all of us, who need those supports to maintain employment. We recognize that these are no small tasks in front of us as a society. However, we believe that in order for OHC to meet our values as a worker-centered healthcare organization and promote the highest standard of health and safety, we must push forward on these initiatives, act for change within our communities, and we hope you'll join us. Thank you.